Welcome to a brand new deep dive. We've got some seriously cool stuff to unpack today.
Definitely. This one is exciting.
We're talking digital twins in healthcare, which sounds like something straight out of science fiction. You guys sent in a ton of fascinating research on this. Seems like everyone is really interested in this.
It's definitely gaining traction, and for good reason.
Yeah.
It has the potential to revolutionize healthcare as we know it.
Yeah, and when I first heard the term digital twin, I thought, okay, is this just another fancy 3D model? But it's so much more than that, right?
Right. It's not just a static representation. It's dynamic, it
Yeah.
evolves, it interacts. It's like creating a virtual mirror of a living, breathing system.
Okay, now that's what I'm talking about. So we're talking about a digital replica that actually behaves like the real thing. How does that even work?
Well, think about it like this. Let's take the human heart, for instance. Researchers at Johns Hopkins are creating digital twins of patients' hearts, and they're personalized, not just a generic heart model.
Wow, so they're creating a digital twin of your heart.
Exactly. They use advanced imaging technology, like MRIs and PET scans, to map out the heart's structure in incredible detail. And I mean every detail, down to the individual scar tissue.
No way. So they're capturing every nook and cranny, every tiny imperfection. What's the benefit of having that level of detail?
Well, it means they can then use that digital twin to predict things like arrhythmias before they even happen.
Wait, seriously? They can do that?
They can. It's incredible. And because each digital twin is unique to the patient, doctors can use it to personalize treatments.
Like what?
Well, take catheter ablation, for example. It's a procedure used to treat irregular heartbeats. With a digital twin, doctors can essentially see how an electrical wave will move through a patient's heart before they even begin the procedure.
Wow. So they're using the digital twin almost like a roadmap to guide the procedure.
Exactly. It helps them target the treatment much more precisely, leading to better outcomes for patients. And get this technology, using digital twins for catheter ablation, it's already received FDA approval.
Wow, FDA approval. That's huge. It really speaks to how effective this technology is. I'm guessing AI and machine learning play a big part in all of this.
Oh, absolutely. AI is essential for analyzing all the data from those scans, creating the digital twin and making it all happen.
It's mind-blowing, really. It's like we're stepping into the world of Star Trek.
Yeah.
But what's even crazier is that digital twins aren't just for individual organs. We're talking about scaling this up in a big way.
Right. We're not just talking about hearts. Researchers are creating digital twins of entire neighborhoods.
Hold on. What would be the purpose of creating a digital twin of, like, a neighborhood? I don't...
I know, right? It sounds crazy. But it's all about understanding the bigger picture of health. Researchers at the Cleveland Clinic are doing some really interesting work in this area.
So what are they trying to learn?
Well, we all know that your zip code can be just as important as your genetic code when it comes to your health.
Absolutely. Your environment has such a huge impact on your overall health.
Exactly. And that's what the Cleveland Clinic is trying to understand, how all these other factors, beyond just our biology, impact our health. They're creating these digital replicas of neighborhoods to study how things like environment and socioeconomic conditions affect people's well-being.
Okay, I'm starting to see where this is going. So they're factoring in things like access to healthy food, safe parks, even things like public transportation.
Exactly. All those social determinants of health that play a huge role.
And I remember reading somewhere that life expectancy can vary by like 25 years depending on where you live. That's a crazy statistic.
It really is. And it just goes to show how much our environment shapes our health. It's pretty shocking when you think about it.
It really is. But how do these digital twins actually help? It's not just about gathering data, is it?
Right. It's about using that data to make a difference. So the Cleveland Clinic, they take all this data, the socioeconomic factors, the environmental data, everything, and they use it to design interventions.
Interventions. Like what? Give me an example.
Okay, so say there's a neighborhood where access to healthy food is a real problem. The digital twin could help pinpoint the best location for a new grocery store.
Right.
Or maybe even a community garden, something that would actually make a difference.
Oh, I see. So they're using this technology not just to identify problems, but to actually solve them.
Precisely. And it's not limited to things like access to resources.
Yeah.
Imagine being able to simulate how a disease might spread through a neighborhood, like COVID, for example.
Wow. And you could factor in all those individual health factors we were talking about.
Exactly. You could see how different communities might be more vulnerable and design public health interventions to target those specific needs.
That's incredible. It would be like having a crystal ball to predict and hopefully prevent these outbreaks. All right, so we've talked about how this technology can be used for individual treatment and for these larger public health initiatives. What's next? Where is this all going?
Well, for one, researchers are working on making the creation of these digital twins much faster, like those heart twins. Right now, it takes days to generate one. They're trying to cut that down to hours.
Wow, that would be a game changer, especially in emergency situations.
Absolutely. And the visualization's getting better, too. More immersive, more intuitive. Imagine surgeons being able to practice a procedure on a patient's digital twin using virtual reality.
Okay, now we're talking science fiction. That's amazing. What else? What other possibilities are out there?
Well, one really exciting area is the integration of different types of digital twins.
Like combining the heart twin with the neighborhood twin?
Exactly. Imagine the insights we could gain from connecting those two,
Right.
understanding how a person's environment directly affects their heart health on a deeper level.
So we're talking about a whole network of interconnected digital twins, a whole ecosystem.
Right. And AI and machine learning, they're going to be crucial for analyzing all the data from these interconnected systems, making connections, making predictions in a way that humans simply couldn't do on their own.
It's like we're on the verge of building a whole new world, a virtual world where we can test out all these possibilities, experiment with new treatments, try out different scenarios, and see how it all plays out before we ever do anything in the real world.
Exactly. It's like having a giant healthcare simulator.
Mhm.
And that's where the real magic happens, right? We can make better decisions, find more effective treatments, and create a healthier future for everyone.
It's incredibly exciting, but we've got to bring it back to our listeners for a minute. This whole deep dive, it started with you, and it got me thinking, if you could create a digital twin of anything to improve healthcare, what would it be?
Oh, that's a good one. So many possibilities.
I know, right? But for me, I think I'd have to go with the brain. Can you imagine a digital twin of the human brain with all its complexity? Think about what we could learn about conditions like Alzheimer's or Parkinson's.
That's a fantastic idea. We could simulate how these diseases progress, try out new drug therapies, maybe even personalize brain stimulation treatments.
Right. Or what about a digital twin of the aging process itself? We could study how our bodies change as we age, right down to the cellular level. Maybe we could even slow down age-related decline, unlock the secrets to longevity.
The possibilities are endless, really. And we're just getting started. That's the most exciting part.
So true. Well, we've talked a lot about the future of healthcare. What are some key takeaways you hope our listeners are walking away with today?
I think the biggest one is that digital twins aren't some far-off fantasy.
Mm,
This is happening now,
mm,
and it's already making a real difference in people's lives.
absolutely. And this field is moving so fast. But it's important to remember that technology is just a tool, right?
Right.
It's up to us to use it responsibly, ethically, to make sure we're creating a better future for everyone.
Couldn't agree more.
Yeah.
It's a team effort, for sure. We all have a part to play.
Well said. And all our listeners out there, we hope you've enjoyed this deep dive. We hope you've learned something new and maybe even feel inspired to learn even more about the incredible world of digital twins. And hey, if you come up with any mind-blowing ideas for a digital twin, be sure to let us know. We're always up for another deep dive. Until next time, stay curious, everyone.